Now, if you've been left wanting to ask a question, of course, of any of the speakers, then remember at lunchtime they'll be out there eating, and please feel free to ask any of the speakers questions then. Unfortunately, we have a sort of limited time. We want to keep the program more or less running to time. Okay, the next speaker, Dr Caroline Méjean, and I think I can actually pronounce this well, I hope. Relationships between liking for fat, salt and sweet, dietary intake and weight status, modulation by socio-demographic, economic, psychological, lifestyle and health characteristics. And I'm so glad that wasn't in Italian. Dr. Méjean.
So, good morning. First, I would like to thank the Fondation Bonduelle for inviting me. Well, I'm a researcher in nutritional epidemiology, and my research area is the determinants of dietary behavior. So I'm going to present you a work about relationship between sensory liking, dietary intake, and weight status. Before going further, I want to clearly define what I mean by sensory liking. According to David Meller, sensory liking is defined as the qualitative hedonic evaluation of a food, the degree of pleasure or displeasure experiences. Here, I want to make the distinction with the term preference, as the two terms are often used in the same way. Preference is better used to express a choice between several alternatives in a given context and time. So here we study the overall liking for fat, salt, and sweet. As you know, fat, added sugar, and salt are important nutritional factors involved in chronic diseases such as cardiovascular diseases, hypertension, or diabetes and obesity. However, fat, sugar, and salt strongly contribute to eating pleasures thanks to their sensory properties. And in recent decades, a part of food supply is turning toward more processed foods with high sensory attractiveness, which can partly explain the overconsumption of fat, sugar, and salt in Western countries. Several studies have shown that taste ranks first among the reasons for individual food choices. So individual sensory liking appear to be an important determinant of dietary behavior. But what do we know about the influence of liking for fat, salt, and sweet on dietary intake and weight status? Previous works showed that liking for fat is positively associated with fat intake and body mass index. Regarding salt and sweet, results are more equivocal. For instance, no associations was found between sweet liking and obesity, or even a negative association in adults. Besides, only 3 studies explore the relationship between sensory liking for fat, salt, and sweet, and intake of other nutrients or food groups, notably healthy food groups. In addition, the studies have several limitations, such as small and highly selected population, and poor reliability in the assessment of liking when the study was conducted in large population. And also, the study includes very few number of confounding factors. Individual characteristics such as social, psychological, lifestyle factors are known to be highly related to dietary intake and weight status. So their interaction with sensory liking as determinants of dietary behavior must be studied. However, only few studies explore the variation in sensory liking according to individual factors. The few available studies show that women have a higher salt liking and a lower sweet liking than men, and no association was found for fat liking. And regarding age, results are conflicting for the three tastes. Regarding eating behavior, cognitive restraint, defined as the control of food intake in order to influence body weight, is positively associated with liking for sweet and inversely associated with liking for fat and salt. And uncontrolled eating, that is the tendency to lose control over eating when hungry or when exposed to external stimuli, is positively associated with liking for fat and for sweet. Previous work also showed that blood pressure is positively associated with liking for fat. However, several individual factors, such as economic factors, lifestyle, or health status, have not been previously studied. So other individual determinants should be taken into account in the study of the association of sensory liking with dietary intake and weight status. So literature suggests that liking for fat, salt, and sweet are major determinants of dietary intake and have an impact on weight status. So this presents a great interest in exploring this topic. And the literature also suggests the need of epidemiological approach in large and diversified populations, using a reliable tool to measure liking, to bring complementary information with experimental study. And using epidemiological data, the elaboration and the test of a conceptual causal framework will allow better understanding on the relative role of sensory liking on dietary behavior. So in our research, we define an a priori conceptual causal framework to guide our analysis. First, we have explored the relationship between sensory liking and dietary intake and weight status. Then we have studied the variation of sensory liking according to several individual factors, demographic factors, eating behavior, status, or lifestyle. And the validation of the global framework is not yet performed. This research study was conducted in the framework of the EpiPref project regarding food preferences and behavior toward fat, salt, and sweet. And this is the result of collaboration with sensory scientists from the Center for Taste and Feeding Behavior in Dijon. One of the aims of the EpiPref project was the use of concepts and methods from sensory science to implement them in epidemiological study. For this purpose, we used participants of the Nutrinet Santé study, which is a web-based prospective cohort on the relationship between nutrition and health and determinants of dietary behavior. Our sample was about 37,000 subjects, mostly women. The mean age was 46 years old. 1/3 of the sample is highly educated and belongs to high occupational categories. 22% are overweight and 8% are obese. One of the aims of the EpiPref project was the development and the validation of a questionnaire measuring liking for fat, sweet, and salt. So we demonstrated the feasibility and the repeatability of the questionnaire, and the internal validity was explored by studying the underlying structure for each taste. The questionnaire included 83 items, dividing into a liking for salt, for sweet, for fat and salt, and fat and sweet sensations. The questionnaire includes 4 types of items. First, an assessment of liking for foods. For instance, participants answer to the question, how much do you like candies, by rating liking on a 9-point hedonic scale. A second part measures the preferred amounts of fat, salt, and sweet seasoning on a 6-point hedonic scale. A third part measures the preferred drinks, unsweet or sweet, on a restaurant menu. And at last, we assess dietary behavior regarding sweet, salty, and fatty foods. For instance, the question, do you salt your dish before testing it? So we compute a score of liking by factor and by sensations, and we estimate quartile of the score to have liking levels from low liking to high liking. Factor analysis demonstrates that liking for salt was liking for salt was unidimensional and mainly composed of items from about the preferred amount of salt seasoning. Liking for sweet was multidimensional and present a hierarchical structure formed by sweet food, added sweetness, and natural sweetness. And the second factor are based on first-order factors that are sweetened food, added sugar in food, added sugar in hot drinks, natural sweetness in foods, and added jam. Fat liking was also multidimensional and composed about items of all parts of the questionnaire. The liking for fat is formed by added fat, based on added salted fat and added sweet fat, and fatty foods based on salty fatty foods and sweet fatty food. And there are first order factors regarding fatty foods, cheese, appetizer, and meat, but also chocolate, Nutella, and pastry. So dietary intake were collected using validated weight-based 20 hours dietary record over a 2 weeks period. Participants fill in the record using an interactive interface designed for self-administration on the internet. And it relies on a meal-based approach for which the participant fill in first the name of all food eaten, and then he estimates the portion size according to standard measurement and using validated photograph. Nutritional values for energy and nutrients are estimated using a published nutrient database. Individual factors such as sociodemographic, economic, lifestyle, and health factors were collected at baseline with questionnaires. And we also collected self-reported weight and age. And psychological factors were collected using the 3 factors eating questionnaire. That is a validated questionnaires that assess cognitive restraint, uncontrolled eating, and emotional eating. And we perform logistic and linear regression stratified by gender for analysis. So regarding the results about the relationship between liking and energy intake, compare with individuals with a low liking for fat, salt, and sweet. Individuals with a strong liking have higher energy intake. This difference is greater for liking for fat, around 170 kilocalories per day, and also liking for sweet with a difference between 150 and 200 kilocalories per day. for the following results. This is the same tendency in men and women, but the difference is more pronounced in men. So to make easier the reading, I will present results only in men. So our results are expressed in percentage difference between individuals with high liking and those with low liking. So compare with participants with low liking, individuals with a strong liking for fat, for salt, and for sweet have lower intakes of proteins and fiber, with a greater difference for fat liking. Intake of total and simple carbohydrates is lower in participants with a strong liking for salt and a strong liking for fat, while the intake of simple sugar is higher in subjects with a strong liking for sweet. Compare with individuals with low liking, those with a strong liking for fat, and in a lesser extent, those with a strong liking for salt and for sweet, have higher intakes of fats, saturated fats, and cholesterol. And participants with a high liking for salt have higher intake of sodium. Regarding iron, vitamin C, folic acid, and beta-carotene, the intake are lower in subjects with a strong liking for fat, for salt, or for sweet. A noteworthy result in our study is a large variation in intake of fruit and vegetable according to liking levels, with a lower intake in subjects with a strong liking for fat, for salt, or for sweet. This difference is particularly important for fat liking, more than 100 grams per day, and for sweet liking, more than 80 grams per day. This difference represents more than one serving of fruit and vegetable defined by international recommendations. And much research has shown the beneficial effects upon mortality of chronic disease of additional serving of fruit and vegetables. So our findings, therefore, provide useful information as they show the need to consider individual liking in nutritional public health policies to promote fruit and vegetable intake. Regarding other food groups, compare with participants with a low liking. Individuals with a strong liking for fat and for salt have higher intakes of savory sauce, salty snack, processed meat, and red meat, particularly for salt liking. And those differences exist for a liking for sweet, but are small. Individuals with a strong liking for fat and for sweet have higher intakes of milk, while difference are weak for cheese, maybe as it's commonly eaten in France. Those with a high liking for fat, salt, or sweet consume lower quantities of healthy food groups such as fish, yogurt, or starchy food. Regarding added fats, individuals with a strong liking for fat and for salt have higher intakes of butter and margarine, and those with high liking for fat consume less oil, while those with a strong liking for salt and for sweet have a higher intake of oil. As expected, fatty sweet foods such as pastries, chocolate, or ice cream are more consumed in subjects with a strong liking for fat and for sweet. And also, as expected, participants with a strong liking for sweet consume more sweetened food, such as honey, jam, or sugar, and also more sweet beverage. And finally, individuals with a strong liking for salt have higher intake of alcohol, whereas those with high liking for sweet have lower intake. So our studies show that fat liking influences intake of both fatty sweet and fatty salty foods. However, further analysis show that individuals with a strong exclusive liking for fat and salt have higher energy intake and lower consumption of healthy food than those with exclusive liking for fat and sweet. So salt might have greater potential for acting as a vehicle for fat intakes and sugar by making fat more palatable. Another explanation is that individuals who prefer fat and salt are more unrestrained eaters or uncontrolled eaters than those who prefer fat and sweet. Regarding weight status, an important finding in our study is that men and women who have a strong liking for fat are 2 times more at risk to be obese than those who have a low liking. Regarding salt, no significant association was found in women, and men who have a high liking for salt are 1.5 times more at risk to be obese. Regarding sweet, results differ by component of sweet liking. Liking for added sugar and for sweet products are positively associated with obesity only in women, while liking for natural sweetness is inversely associated with obesity in both sexes. So our studies showed that liking for fat, salt, and sweet is associated with unhealthy dietary patterns and higher obesity risk, particularly fat liking. But the original findings of our study is that high liking for fat, salt, or sweet is associated with lower intake of healthy foods, such as fruit, vegetable, or fish, but also dietary fibers and vitamins. This is, how to say that? Individuals with increased liking for fat, salt, and sweet may be less interested in healthy foods because they find them less tasty, and so they may replace healthy foods by energy-dense variants. For instance, they may choose cheese instead of yogurt or processed meat instead of chicken. So our findings, therefore, have important public health implications as they show the need for taking into account the influence of liking in public health policies that aim to limit fat, sugar, and salt intake, but also increase the consumption of healthy foods. Our results show that difference in intake between individuals with high liking and those with low liking are stronger in men than in women. Dietary restraint might affect the relationship between liking and intake to a lesser extent in men. Our study also shows that high liking for fat is associated with unhealthier dietary intake and higher obesity risk compared to liking for sweet and liking for salt. So this is a useful information to prioritize effort for improving food supply between fat, salt, and sugar contents in food products. Regarding association with individual factors, we show that liking for fat and salt and liking for fat and sweet decrease with age, and that highly cognitive restrainers are less likely to have a strong liking for the two sensations. We also found that subjects with low income and those who have at least one child in the household are more likely to have a strong liking for fat and salt and fat and sweet sensations. Uncontrolled eating is positively associated with liking for fat and salt and fat and sweet. while emotional eating is positively associated with liking for fat and sweet. Current smokers and heavy alcohol drinkers are more likely to strongly prefer fat and salt. Obese and current dieters are more likely to have a strong liking for fat and salt sensation. And menopause and pregnancy are positively associated with high liking for fat, whereas individuals with hypertension or hypercholesterolemia are less likely to have a strong liking for fat and sweet. Regarding liking for salt and for sweet, we found that in both genders, salt liking increase with age, whereas sweet liking decrease. Current smoker and heavy alcohol drinker are more likely to like salt. Regarding the sweet taste, women smokers are less likely to like sweet. Highly uncontrolled eaters and highly emotional women are more likely to have a high liking for sweet, whereas those with high cognitive restraint are less likely to have a strong liking for sweet and salt. Heart loss, former weight loss dieters are less likely to have a strong liking for sweet. So we identify specific profile according to liking that allow characterization of high-risk population. We found common factors associated with liking for fat and salt and liking for fat and sweets, such as age, low socioeconomic status, or menopause. For all tastes, uncontrolled eating is positively associated with liking, while cognitive restraint is inversely associated. Psychological factors influence the intake of energy-dense food. So they may also influence liking due to modified exposure to these foods. Smoking and alcohol consumption are positively associated with a strong liking for salt and a strong liking for fat and salt, maybe due to the fact that alcohol and alcohol intake and smoking alter the perception of salty taste. Emotional eating is positively associated with a liking for sweet and a liking for fat and sweet, as shown in studies about dietary intake. So this suggests that emotional eating is probably specific to a sweet taste. Our studies suggest underlying mechanism different according to the taste, and interpretation of results regarding socioeconomic factors or emotional eating may be behavioral due to difference in dietary habits and higher exposure to fatty and sweet foods. Finding about age, menopause and pregnancy, but also smoking and alcohol consumption may reflect physiological changes such as modification of taste sensitivity. So in conclusion, high liking for fat, sweet and salt is associated with unhealthy dietary intake and higher obesity risk, and also specific socio-demographic, psychological and health profile. So our study highlights the need to take into account individual sensory determinants in the study of determinants of dietary behavior, but our study also emphasized the need to centrally position taste liking in public health strategies that aim at improving dietary behavior. This can be done at individual or environmental levels via sensory education measures or improvement in food supply via large-scale public health and food industry efforts, but also in the management of persons at risk of chronic diseases, such as effective dietary counseling. So our perspectives are the identification of confounding factors and effect modification in the relationship between liking, dietary intake, and weight status. So we will study the influence of sensory liking on weight variation, over 5 years using prospective design, and we will test and validate the conceptual causal framework. So you will find more information in our publication, but also on the website of the Nutrinet Santé study and the EpiPrev project. And I would like to thank Aurélie Lampuré, which is the PhD student who worked on this topic, and also my colleague Katia Castelbon and Serge Imberg. I would thank Pascal Flich and Amélie Degler from the Center for Taste and Feeding Behavior, and also thanks the participants of the study. Thank you.
Thank you. That's very, very interesting data set, and I think I can say that we've been waiting a long time in sensory science to adopt epidemiological approaches, and I think it's very, very exciting. Time for questions. Yes, over there.
Thank you very much for this great talk. And as a fundamental biologist and especially interested in neuroscience, I find it really interesting what you're saying, especially about alcohol and smoking, because there's probably the same neural pathways that drive you towards alcohol and smoking consumption as towards fat and sweet. So do you have, or have you performed, or do you have any data also on neurological studies of these patients, especially what areas of the brain can be activated when they are confronted to fat, sweet in front of them, and what could be changed?
No, I don't know. I don't know if there are data about there's information to interpret our result. We found that previous work show that a high dose of alcohol alters the perception of salty taste, and also that smoking decreases the olfactory function and also affect taste sensitivity. But I don't have any more information about this result.
I mean, as you say, it's probably common pathways, reward pathways would be the most likely. Any further questions? I'll ask one question, taking the prerogative of the chair, that it struck me at the end that the things that are associated with bad outcomes, if you like, are exactly the sort of things we've evolved to prefer. That is fat, sugar, and salt. Those things actually keep us alive. And the implications of this are quite profound, it seems to me. That's not my question. My question is, when you said at the beginning that salt liking is unidimensional, what do you think that meant? What are the implications of that it's unidimensional?
I think there are two interpretations. First, the way that we construct the questionnaires. As we didn't find only salty foods, or in the food supply, in the French food supply, we only found fatty and salty foods, and not only salty foods. So we did not include those items in our questionnaire. So the salty food, the liking for salt was composed mainly of items about salt seasoning. Yeah. So I think this is the problem, but not a problem, but this is the reality of the food supply also.
Well, also possibly a biological reality, in the sense that the one unequivocal hunger that humans and most other mammals get is for salt. And that there is, if you look across cultures, across different people, everybody has preference for salt. And so that struck me as might be consistent with that. Anyway, thank you very much.
Thank you.